Hello everyone, hope so all of you are fine and welcome to my channel. In this video we will discuss about mechanical support system in cardiopulmonary system. First of all we will discuss that why we need to give mechanical support in cardiopulmonary system. Cardiopulmonary system further consists of two types of systems, cardiac support and respiratory support, and in the same way it has two types of mechanical supports, cardiac support and respiratory support according to their systems. Now, why we need to give cardiac support to the patients? We know that the function of heart is to pump blood to the body. If due to any reason heart is not pumping blood towards the body or its function is disrupted, then we need to give cardiac support to the patient's body, and that cardiac support include any mechanical device that we attached to the body so that the heart pumps blood to the body and we can live alive. There are two types of cardiac support, intra-aortic balloon pump and second one is ventricular assist device. We will discuss both of these types in detail in the further lectures. Now, second type is respiratory support. Why we need to give respiratory support to the patients? As we people know that molecular function of respiratory system is gaseous exchange. If due to any reason gaseous exchange is not occurring, then we need to give respiratory support or respiratory device to the patient so that the gaseous exchange can take place in the patient's body and he can respire properly. Then mechanical function of respiratory system is ventilation. Ventilation means breathe in and breathe out. Same if the patient's ventilation function is disturbed or he has difficulty in breathing in or breathing out, then we also give respiratory support to the patient so that he or she can ventilate properly. Now we will discuss types of respiratory support. There are 5 types of respiratory support. In this video we will discuss only their names, and in the further proceeding lectures we will discuss about them in detail. Number 1 respiratory support is oxygen therapy. Number 2 one is conventional mechanical ventilation. Conventional mechanical ventilation also has further 6 types. Number 1 continuous mechanical ventilation. Number 2 intermittent mechanical ventilation. Number 3rd one is synchronized mechanical ventilation. 4th one is inverse ratio mechanical ventilation. 5th one is inspiratory pressure support mechanical ventilation, and last and 6th one is respiratory support mechanical ventilation. These all 6 types are of conventional mechanical ventilation. Third type of respiratory support is continuous positive airway pressure, also called as CPAP. CPAP is also further of two types, continuous flow and demand flow. Fourth one type of respiratory support is non-invasive mechanical ventilation, and last and fifth one type of respiratory support is positive and expiratory pressure, also called as PEEP. That was all about our today's lecture. Hope so you will like my video. If you like my video, don't forget to subscribe my channel.